Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, I'm going to take a break from these Eastern nutrition episodes. I guess I was making up for several weeks of having not done one, and Chef Kiara's just really been on my back about it. So, what's going to happen here is I want to take a break from even doing requests from individuals who've already downloaded the Acupuncture is My Life app and focus on something that my colleagues and myself come across a lot in our clinic. And that is signs that your pancreas is being destroyed. Okay? That your pancreas is damaged, it's being destroyed. There's certain symptoms that your body will give off, and I've faced this on several occasions. There have been patients who have come into the Acupuncture is My Life clinic presenting with certain symptoms and not understanding why. And I say this over and over because acupuncturists tend to search for the root cause. We don't focus on just your symptoms. Now, we may treat your symptoms. If the discomfort is just overwhelming, we may focus on that and a little on the root until we can suppress the annoying aspects of the symptoms enough where we can just focus on the root to clear up the issue. Now, there have been patients who would walk into acupuncture clinics, and present with symptoms, and then only to find out that their acupuncturist realized, in this case, there's something wrong with the pancreas. You have to understand something. The pancreas is a powerful organ, and it's very responsible. It's very much responsible for keeping us healthy. It's responsible for our overall health. It's a small organ in the upper part of a person's abdomen that's extremely important and produces powerful digestive enzymes, as well as it secretes hormones, which are vital for metabolizing sugar, and which, of course, we use for energy, especially the brain, especially. Upwards of 70% of the glucose, which is stored inside of our body, the brain uses on a regular basis. Yes, indeed. The pancreas is super important. My colleagues and I, we've had patients come in experiencing abdominal pain, to find out that it was actually due to pancreatitis, which of course can be acute or chronic inflammation of the pancreas. Okay? So it's important that you understand what certain symptoms may represent. It's your body just giving off signs that something is wrong. Because large tumors can press against organs that are adjacent to it and cause abdominal pain, which can now be a symptom of pancreatic cancer, which of course is an abnormal cell growth in the pancreas. Now, back pain can also be related to either pancreatic cancer or even inflammation of the pancreas, which is called pancreatitis. And if you're experiencing this back pain, where it gets worse when you lie down, especially if it gets worse 3 to 4 hours after you eat, see an acupuncturist and even your local physician. But more so, first and foremost, an acupuncturist. Because you don't want to be misdiagnosed in a sense, and I'm not saying a physician would misdiagnose you in any way, shape, or form, but you don't want it to be seen as just back pain, here, take some pain meds, and, an acupuncturist goes way deeper. And this is why I'm saying over and over, download the app, because there's so much you'll learn about acupuncture. Now, another sign that your pancreas is going bad, malfunctioning, issues with it, is fever. Fever is an indicator of a lot of things, but it can be an indicator. It can be indicative of pancreatitis as well, because now once the enzymes of the pancreas begin to leak out into the tissues of the pancreas, it tends to cause irritation, edema, as well as congestion of the blood vessels. And this is what contributes to fever. I've even had patients that would come in experiencing nausea and vomiting and not know what it was due to. Where there was one, it was due to pancreatitis, but there were a few of them, it was due to pancreatic cancer. Which can be tied. It can be tied to smoking, both smoking and obesity. Now another is high blood pressure. Why? Because it could be due to you drinking too much alcohol, trauma, gallstones, blocking the pancreatic ducts. Because high blood pressure can be an indicator of pancreatitis. You have to understand something. Health is wealth. The wealth is not in the bank, a safe, your pocket, your purse, under your mattress, in a shoebox in a closet, under the doghouse in the backyard. It's in you. Understand that. And once you do, when you're experiencing these types of symptoms, you would go to your acupuncturist or a local acupuncturist, or even contact acupuncturists in my life right away. I say this many times, along with regular visits, annual visits to your physician, you should be seeing an acupuncturist regularly. And you and your acupuncturist will determine what's regular. Now, do you ever experience cold and moist skin? Clammy skin with a low blood temperature? This can be a sign of a very bad case of severe pancreatitis, which, this condition can cause, let's say, infection, formation of pus in the organ, bleeding, necrosis of the pancreatic tissue. Not good. See, if you were undergoing regular wellness visits, you would already know this. Jaundice as well. I speak of jaundice a lot. Yellow eyes and skin, dark colored urine. And your stools, your bowel movements are light colored and they're very greasy. Jaundice can be a sign of pancreatic cancer, usually as a result of a tumor blocking the bile duct. All right? As along with noticing changes in your stool, because when the bile duct is blocked, it causes stools to become pale or a clayish looking color. And the smell would be terrible. And why? Because you have a higher fat content in your feces. You have to understand that. Another symptom can be itchy skin. And this is accompanied with abdominal pain and jaundice, which can be a sign of pancreatic cancer. And pancreatic cancer also changes your bowel movements. It can alternate between diarrhea and constipation because nutrients from the foods are not being absorbed. Or it could just be due to you being on pain medications. There are several causes of pancreatic cancer, but you have to be careful. And it's best to see an acupuncturist. That's why I'm always telling you. Make acupuncture part of your life. Because acupuncture is my life. What's yours?